Welcome to the Health Annex. Welcome to the Family Practice and Counseling Network in beautiful and sunny Southwest Philly. My name is Jacob Hope. I am the Outreach and Enrollment Manager here at FPCN. I've been doing this work for over 7 years, helping patients and community members sign up for health insurance through Medicaid, through Pennie, also food stamps, heating assistance, you name it, we probably do it. So welcome. And thank you for choosing the Health Annex and FPCN to hold this press conference. And thank you for trying to get the word out about health insurance and healthcare. It's all very intimidating. And I think one of the ways we try to do things here at FPCN is make things approachable. And I think that's great because we're in the community room. And I think that's a good message for that. So we're having a couple speakers today. I'll share a patient story in a second, because I think stories are important too. And then Laval from the Pennsylvania Health Law Project and the Pennie Board will speak. Welcome, Laval. Michael, where is Michael? Hey, Michael, from Pennie. He's the Pennie Commissioner. And then Zach Sherman, the Executive Director of Pennie, will also be speaking. So I wanted to really share a story. I think stories are important because, like I said, healthcare can be very overwhelming, intimidating, and health insurance probably even more so. Or maybe they're tied. I don't know. It's not a competition. So the story I wanted to share was the story of Fanta and her husband Amara and her 2 kids. So Fanta is a refugee from Liberia, and Amara is from a neighboring country, Guinea. And her husband came over to the U.S. in 2006, and they've been uninsured the whole time. So Fanta's been working as a caregiver, right? So she gives health care to people, and she doesn't have health insurance or care herself. And her husband, Amara, is a delivery driver. So I met them in February, and I was able to help their kids sign up for CHIP. They got CHIP. CHIP was great. They love CHIP. Easy. Now, due to their income, Fanta and Amara had to wait until open enrollment for Pennie. But like many people, they were pretty nervous, and they didn't even know that they actually qualified for health insurance. I think that's a pretty common experience. And they were happy to hear that they could. So this was really important to Fanta because she's been having, over the past couple of years, just kind of like worsening stomach pain. You need to go see a specialist for that. What do you do when you don't have insurance to see a specialist? You have to pay cash. She couldn't afford that. They couldn't afford that. So they were one of the first people that I called when open enrollment started in November. And signed them up. They both got a great silver plan, about $40 a month. And dental plans, about $21 a month. So they're pretty happy. So after finding out about the press conference, I called her. She is kind of a woman of few words, so I did want to share those words, though. So she just said, it's important to stay healthy for yourself and for your family, and this insurance will help us do that. For the last 4 years, I've been having to check my cholesterol all the time and get tests for stomach pain, but I've been unable to. So now I can do that, and I thank you for that, and I really just wanted to say that the health of myself and my family is very important. So, those are the words of Fanta. I just wanted to thank you. Thank you to Pennie. Thank you to everyone who's helped protect Medicaid. I think coming up, I think another important thing to keep in mind, not just Pennie, but Medicaid coverage too, and CHIP, right? They're all kind of interconnected. So I know we hear open enrollment deadlines coming up. Make sure you sign up by the 15th, but also Medicaid's there for people too. And let's make sure we keep protecting Medicaid in the future. So, without further ado, I'll pass it to Laval. Welcome.
So good afternoon. I'm Laval Miller-Wilson, and I have the privilege of being a member of the board of directors of Pennie, and I also run the Pennsylvania Health Law Project, and the latter is a nonprofit and we help people navigate the health insurance landscape, primarily in Medicaid. And I'm here to talk about Pennie and to encourage people to sign up for health insurance, noting that the deadline is a few days away. It's January 15th, and it's so important to make sure that that you meet that deadline to get the Pennie coverage. And let me say a little bit more about Pennie. I've been a member of I was part of the founding of of Pennie, and I'm so pleased that we have in our Commonwealth a system in which we created a state-based marketplace. Obviously, that's called Pennie. And I'm so proud of to be a part of the board, which is a tremendous board of health insurers and advocates like myself and government officials from state government. I'm also so proud of the Pennie staff. They are a terrific staff, and it took so long to, not long, it took so much effort to get Pennie underway. And it is a really well-functioning marketplace. And I can assure you that if you get that coverage, it's great coverage. You make decisions about how much coverage you get. But I'm very proud of what we do at Pennie, and especially about the financial assistance that provides to folks. Insurance continues to be expensive, but by going through Pennie, it can be affordable for you. It truly is. And the work that's been done, I will say, by the Biden administration, by Congress, to put more subsidies into place, really make Pennie more affordable than ever. So it's a great deal. It's important coverage. It's necessary coverage. We really encourage folks to take advantage of the time that we have and get enrolled. I can be a bit of a procrastinator myself, and it's all right. We are staffed up to make sure that people are answering the phones and can help people navigate. Get your applications in. I also just wanted to share that at the Health Law Project, the organization I run, when I was describing before that we help people navigating the coverage, that one of the great things that we like about Pennie is, and the system that we have in Pennsylvania, is that there is no wrong door, that you can apply to Pennie, and if you're found not eligible for marketplace coverage, you can get, we will shift you at Pennie over to the state Medicaid agency. And maybe you're able to get that coverage, which is also good coverage, but a different sort of coverage. And so what we've created in the state is no wrong door. Go to Pennie. We will take care of you. If it's not Pennie coverage, we'll direct you to the state Medicaid agency and hand you off. It's I think, a pretty seamless handoff. And we'd like to hear about people's experiences with that. So I just wanted to highlight about that. One piece that is particularly an issue is we've been hearing about the public health emergency ending in this calendar year. And it probably is a pretty sure bet. I'd rather bet on the Eagles but I think that it will likely be that it will end this year. And so that's going to create some opportunity for people that had the Medicaid coverage to come over to Pennie. Now, that's not necessarily the purpose of today's press conference. We just want to emphasize it's January 15th. But what I'm excited about is that Pennie's probably going to get a lot more people coming from Medicaid over to Pennie. And I feel good about the transition that's ahead to make that happen. Let me just see if there's anything else I wanted to just highlight before turning it over to Commissioner Michael Humphreys. No, it's a great chance to get health coverage, dental coverage during this open enrollment period. It's a great chance to get coverage. And I'm happy to just share that note. And if we take questions at the end, that's fine too. I'll be available. So that's my message. And without further ado, I'd like to introduce Insurance Commissioner Michael Humphreys.
Thanks. Good afternoon. My name is Mike Humphreys. I am the acting commissioner at the Pennsylvania Insurance Department. I'd like to first thank Jacob and the Family Practice and Counseling Network for inviting us here today. Really appreciate the opportunity to come out here and speak to the community. Also wanted to thank the staffs of Representative McClinton, Representative Young, Senator Hayward, and Senator Williams for coming out today. Your support for Pennie has been very much appreciative. Without legislative leadership, there would be no Pennie. So very much appreciate the legislature for passing what ultimately was a unanimous piece of legislation to bring control of our state-based exchange to Pennsylvania. Also wanted to put in one more word of thanks for the gentleman that'll follow me. Zach Sherman has been executive director of Pennie since day one. In addition to the legislature, to Governor Tom Wolf and his team, Pennie wouldn't be where it's at today without Zach Sherman. Zach, really appreciate not just our friendship, but everything that you've done to work for Pennie to make coverage more available, more affordable throughout Pennsylvania. As Laval mentioned, as Jacob mentioned, we're here today to talk about January 15th. We strongly encourage people not to wait until the 15th. Enroll now. Go on pennie.com, pennie.com, and check the affordability of plans. Check the type of plans that may be available to you. If you shopped 4 or 5 years ago on the exchange, didn't think it was affordable then, come back. Whether you're a single parent of a child looking for coverage, a two-parent household where someone works and has coverage available, but really coverage hasn't been available for the full family, come back to Pennie and take a look at it. Laval highlighted that coverage has never been more affordable than it is today, thanks to actions with the Congress and President Biden and the administration. Its coverage is within reach and affordable for more people across the Commonwealth. And two priorities that we personally have had at the Insurance Department was to provide more options to consumers and to do what we could to lower premiums even more. The first option in terms of increasing marketplace competition, in 2023, every single one of Pennsylvania's 67 counties will have at least 2 insurers. Here in Philadelphia County, those going on Pennie will have up to 5 insurers that are competing for your business. It's okay to shop around. It's okay to look at those plans to see who offers you a network that includes your doctors, a formulary that includes your prescriptions at a price point that you're most comfortable. Look at the deductible, look at the cost share, look at the copay, look for your doctors, look for your medications, and make the selection that provides the right benefits for you. If you need assistance, Pennie has customer service staff. There's navigators and assisters across the Commonwealth that can help. And the Insurance Department is here to help. If there's any questions about policy benefits or if you have concerns about the coverage being provided for you, please, insurance.pa.gov. That's why we're here. That's why my department is available to consumers to really walk you through any questions that you may have about insurance. And finally, on the affordability piece, with the legislation to create Pennie, we also created a reinsurance program that helps provide reinsurance directly to insurers that insure individuals with high-cost claims throughout the year. That program has kept premiums from about 4 to 6% on a year-over-year basis, has held down premiums from where they would otherwise be. So another credit to Zach, to my predecessor in the Wolf administration and the legislature for really putting together comprehensive legislation that would connect people with policies at really affordable rates and would provide this reinsurance opportunity that would, into the future, really try to keep rates low. So again, I really appreciate the opportunity to be here and would encourage everyone to go on pennie.com and search for a policy that fits your needs. And with that, I will turn it over to Pennie Executive Director Zach Sherman. Thanks, Zach.
Thank you, Commissioner. Thank you to the Family Practice and Counseling Network, to Jacob for having us here today, and to Laval Miller Wilson, our member of our board, for his continued and lasting support and leadership for us. And I just want to call out the consumer story that Jacob told. It's through stories like that we really kind of get across the point of what we're doing, get across the benefits that we're providing to Pennsylvanians across the Commonwealth. So thank you for sharing that story. So we are here today to talk about and promote the end of open enrollment through Pennie. This Sunday, January 15th, is the last day to sign up in 2023 open enrollment, and that's for coverage that begins on February 1st. So this is the last chance to come in and check out what we have during open enrollment. Having health insurance provides comprehensive benefits. It gives you peace of mind, financial security, and access to preventative services to catch things before they become real problems. As we've already talked about today, a big reason to come to Pennie is the financial savings that we provide for so many of our customers. 9 out of 10 of Pennie customers receive financial savings, and nearly 40% of them are paying less than $75 a month. 1 out of 4 pays $1 a day, and the average savings that we deliver to qualified customers is about $500 a month. With costs rising everywhere and budgets really stretched thin, these savings matter, and these savings are the difference for so many customers being able to afford health insurance and health care and going without. One trip to Pennie.com is the first step to protecting your health and your wallet. So as the Commissioner mentioned, if you checked out Pennie or the marketplace before and it didn't work out for whatever reason, it cost too much, there are additional savings available today and new saving opportunities. So we really urge you to come back and check us out, ideally before this Sunday. Financial assistance has increased at every level of income, and no one is asked to pay more than 8.5% of their income. In some cases, customers qualify for low-cost or even no-cost plans. There's also a change in the affordability in the cost of health insurance for Pennsylvania families who get coverage through their work. Those asked to pay more than 9.2% of their income for their family plan that they get through their job can now come to Pennie new this year to receive premium savings to reduce their cost of coverage. We very much understand applying for and enrolling in health insurance can be overwhelming. Please know that we provide assistance. There's assistance available to help you navigate through the process, getting you from confused to covered. Assisters like Jacob, licensed insurance brokers, and customer service representatives are all trained and certified by us to provide you answers and guidance along the way. Assisters and brokers are your friends and neighbors in your local community, and they're able to help in person, virtually, or over the phone, and in one's preferred language. Find one quickly at the Connect page at Pennie.com or by giving us a call. Pennie customer service can be reached at 1-844-844-8040, and help is available in English and Spanish. There's also a language line that connects customers who speak other languages to an interpreter. I want to stress again that this is the final deadline for open enrollment. If you or anyone you know is in need of coverage, go to Pennie.com by Sunday, January 15th, to enroll in one of the high-quality options available to you in your area. Again, the website is Pennie.com, Pennie.com, and Pennie customer service can be reached at 1-844-844-8040. Our call center is available, is open all this week from 8 a.m. to 7 p.m. Today through Friday. On Saturday, it's open from 8 a.m. to 1 p.m. And on Sunday, deadline day, it is open all day from 8 a.m. to midnight. Thanks for joining us today, and now we'll open it up for any questions you might have. You can't ask questions. Yeah.
It's just, and I'm sorry, because I didn't necessarily say this in the remarks, but do you want it, I'm happy to do it, give a pitch about why people need health insurance?
Yeah.
Or do you mind if I do it?
I do not mind at all.
One of the pieces, I think sometimes people forget why health insurance is so important. And one of the great places about the Family Practice and Counseling Network is that it's a federally qualified health center. And you can get, they don't take a lot of look at the income. That's why they exist. Federally qualified health centers like this place provide coverage. And while there's a very small fee, their mission is to serve folks without insurance. And if you have insurance, of course, that's fine too. But they're outpatient. What happens if you get hit on the way out of this parking lot and this where we are today? What happens if you need inpatient? You're not coming in. This isn't a place that serves inpatient. If you need rehabilitation, if you need medication to treat a cancer, that's where the importance and the safety and the ease of health insurance comes in. That's why you need the coverage. That's why you should have the coverage. That's why you should ask people, do you have health insurance? And I have changed over time, over the last several years. I used to not talk about things like health insurance. Now I ask people, do you have health insurance? And have you heard about Pennie? And that's what I really encourage folks to do. It's almost going ahead and asking people out of just kindness, because you're now in a position to say, if you don't, here's where you could go. But that only exists for the next few days, because January 15th, then it stops, absent of special circumstances. So we have the environment. Health insurance is really important. It gives people peace of mind and ease. It's necessary when you live in our society. So please sign up. It will make you and people that you care about just feel much easier.
Thank you, Lavon. Yeah, I would just add to that, maybe one of the reasons you talk about it more these days is it's more comprehensive than it once was. All of the plans available through Pennie, if you have a pre-existing condition, you cannot be denied the ability to enroll in it. All of the plans cover what's known as the 10 key essential health benefits, and a key consumer protection that's available is that there are no annual or lifetime limits on what the plans will pay out in terms of qualified benefits. So it is really a good deal. It's really important, and thank you all for sharing that.
Is this only designed for families, or is it designed for also individuals?
Individuals or families. It's really for people who don't have access to comprehensive, affordable coverage through some other means. So if you don't have a plan that you can afford through your job, or you don't have access to a plan at all, if you're not qualified for Medicaid or medical assistance or Medicare, it's for individuals and families outside of that who don't have any other option, that have to go to the individual market to get plans for themselves. That's where we exist. We're the marketplace, and we provide financial assistance and customer service and enrollment assistance along the way to get people covered.
I could add to that just to,
Yeah.
just to add, because I think it is important to say, like if a lot of our patients, Medicaid keeps denying them, so you keep applying for Medicaid, you keep getting denied. Pennie might be your option. Uber drivers, kind of gig economy, people who are self-employed, we've seen that grow kind of exponentially every year. More and more of our patients are Uber, Lyft, DoorDash, all those kind of things. So if the county assistance office, people still know it in Philly anyway as the welfare office, if they keep denying you, Pennie might be your option. Also, immigrants is another good example. A lot of immigrants can get health insurance, and it's through Pennie. So I just think that's a really important message too, right? If you're an immigrant, you can get insurance, probably through Pennie.